So perfect. Here we are then, live into the ladies watching all over the world. So thank you so much, David, for coming in to talk to us. I so appreciate your time, and I'm so looking forward to this discussion. So can we start off with you giving an intro to the ladies and just sharing a wee bit more about your background, what you do, how you got into it, and that type of thing?
Sure. Yeah, I'm excited to be here. I love talking about all things at the intersection of recovery and food. I am a person in Los Angeles. I have lived here my whole life. My undergraduate training was in social science, and I certainly have a history of partying. I'm a product of the rave scene in the late 90s, early 2000s. And so my own personal journey with health led me to pursuing a master's degree in nutrition. I worked as a trainer during graduate school and was really blown away by the effect that nutrition had on my own personal mental health. My experience was that as someone who hadn't really dove into nutrition or regular exercise or even anything related to wellness like sleep and sunlight and water, when I actually did those things for the first time, it had a marked change in my not only appearance and physiology, skin tone, but really also in my cognitive processes and in my mood. So my own personal experience really suggested that nutrition isn't shallow. Nutrition isn't just about abs and muscles and adipose tissue. Nutrition is about mental health. And that was what my experience confirmed back in 2006. And so, you know, when I did a master's degree in nutrition to become a registered dietitian, I became interested in the intersection between nutrition and substance use. My master's thesis was on nutrition and eating behavior among people with or without a history of drug and alcohol. So that became really, really new in terms of areas of inquiry. The food addiction concept started blowing up around that time. So I became interested in drug and alcohol addiction, food addiction, and then began working clinically at the intersection of all these things and have done a lot of work with people that have eating disorders. So I work with challenging cases, people that have a history of addiction-like behaviors, as well as restriction-like behaviors. And I work with people at the intersection of alcohol and eating disorders. And I founded Nutrition and Recovery, which is 2012, and built a group practice of registered dietitians who work in this mental and behavioral health space. And then, you know, that's been going on for the last 9 or 10 years. And 5 years ago, I went back to school again to get the last one. And I went to UCLA to study public health. And I got my PhD in community health sciences, and I did a minor in health psychology. So my PhD dissertation was on the link between early life adversity and mental health. So my work in the last few years has really been focused on trauma and trauma-informed nutrition and how to understand people's relationship to food over their life course, and how to message properly so that nutrition interventions aren't alarming or triggering or traumatizing for people.
Wow. Oh my goodness. I'm like, oh my God, there are so many questions I want to ask you. I love everything that you've just shared. That's just incredible. I'm interested to know, for most people that do go on to, and we'll talk about what food addiction actually is in a sec, but does it start in childhood? Do you think it depends on the environment that you grow up in? And is it about how food is talked about, or is it more about whether you experience some kind of trauma in childhood and then you turn to food or sugar as a comfort?
Yeah, the timing of certain exposures is one of the big kind of questions in life course epidemiology, right? Like, you know, what disorder came first? Was it the sugar addiction or the alcohol addiction? And it's a biased question because people get exposed to food before they get exposed to alcohol and drugs, right? So I'm very interested in figuring out like which comes first. But, you know, usually, you know, the highly palatable food exposure begins at such a young age that truly is the thing that the brain learns first, right? So if you use the trauma susceptibility model, early life adversity, early life trauma is definitely going to set someone up for more reward-based behaviors. There's definitely a heightened interest in the dopamine response elicited from substances. So certainly early life trauma can prime someone for addictive-like behaviors. And the one that someone's going to find in early life is going to be sugar and highly palatable foods. The other model that could support that early life kind of food addiction is just genetic underpinnings related to addictions, right? Some people might have a dopamine receptor deficiency. There's a lot of things that could make someone more susceptible, either from the germline or through in utero or early life exposure. So I think the last part of your question that I'd like to answer is that a lot of people do have food-related trauma, such as, parenting styles where, food was used more as a reward or a punishment, or there was messaging around it. Parents have certain ideas, family members, and that can certainly be impactful in one's relationship to food over the lifespan. And so those are all the kind of things I think about when I work with someone. It's not just like, oh, this is what you need to do with food. It's like, no, we need to think about all of these nuances. We need to consider all these different contributors to eating pathology.
It's so interesting. And I'll give you an example. So I have 2 children. My son, take it or leave it with sugar. Just, they both have the same upbringing. They're very close in age. There's been no significant trauma in their life. He has no, take it or leave it. You give him a cake, he might have it, he might not. My daughter, at the other end of the scale, if she knows that there's a cake in the house, she can't settle. She has to go and eat it. She will keep going. She hides food. She does all of that. So that just shows me that perhaps it's a genetic thing. I know that I had, as we've talked about, alcohol addiction. And so is that something that's epigenetically gone through to her? And do I therefore probably need to be more aware of how that might play out for her going forward?
I think that's a very wise way to think about it. And I could say the same about my family. On my mom's side, there's a history of alcohol and addictions. On my dad's side, not so much. And if you compare me and my brother, who's 19 months older than me, I was highly primed for palatable food consumption, whereas he wasn't. And I was so jealous. I was so upset that he could take it or leave it and I couldn't, right? Growing up.
Yeah.
And so, yes, I think that looking at it, from those biological underpinnings is wise. However, in social science and sociology, public health, we always try not to be so reductionistic and look at things solely from biological drivers. We always want to put things into context. And so, an example of context could be that, let's say there was a difficult day, a lot of negative emotions, stuff came up, and there was cake around, right? Chronic exposure to the substance under states of negative affect are essentially going to teach the brain, what substances work to reduce that negative affect. And over time, the brain's going to assign more value to that cake, right? So you couldn't just say it's purely genetic. You'd have to say the genetic vulnerability set up the chronic exposure and experiences that essentially produce the salience, what we call something being more memorable, or the brain assigning more value to it, which then sets up the repeated behaviors over the lifespan. And so, it's always important to think about biology, context, psychology, and look at it comprehensively.
Yeah, that's so interesting. I've just finished reading the book Dopamine Nation, and she talks a lot about the availability of the thing plays a massive role in how likely we are to become addicted to it. And she gives a really great example of prohibition in the United States, and then when alcohol came back into the picture and how those levels started rising very, very quickly. And it's it's really interesting to make that that analysis around it. And so with regards to the clients that you work with, I'm curious to know, because I find in the work I do that it's a very similar strategy in terms of what we talk about with whatever the thing is that the person is trying to change their relationship with. So whether it's alcohol, whether it's food, do you approach each very differently, or is it quite a similar kind of approach when you're looking at someone with food addiction versus alcohol addiction?
There definitely is some overlap, and there are some marked differences. The overlap really lies from this idea that, one has to manage the underlying stressors, get what we call in recovery, spiritually fit, right? Set your life up to be supportive, recruit social support. There's a lot of things that are similar, but in terms of like the, specifics around abstinence plans versus harm reduction plans, there's a wide variation of things that can work for people there. And so I'm always real wary of people that have a single, model, and they believe everyone should fit into that model. Just like with alcohol recovery, if everyone thinks that it has to be 100% abstinence and you can't use anything else from the neck, like those sort of things, are, potential drivers of people feeling, they drive people away rather than, toward. So with food, you could think about, for example, one could think about, abstinence of very specific foods, right, that are problematic. For example, like, someone might not want to say, I need to be abstinent from sugar because that's in the salad dressing and that's in the things. They might say, I'm going to be abstinent from ice cream, right? Something very specific versus something very broad, like an ingredient, right? Versus a specific food. And then you could think about, behaviors rather than substances. So instead of saying, I'm going to be abstinent from ice cream, you say, I'm going to be abstinent from eating ice cream when I'm in a bad mood or when I'm by myself, right? Sure. Someone might say, I'm down to eat ice cream when I'm with my life partner at a restaurant and they bring dessert. That's very different than eating it at 1 a.m. when, right, you're in a night eating spiral, right? Those could be very different things. Someone else might consider, developing abstinence strategies that are more focused on behaviors rather than specific foods. I'm not going to order food delivery. I'm not going to go through drive-throughs. I'm not going to be dishonest about my food with people. So there's so many different nuances when it comes to food and eating disorder recovery. Some people benefit from having no rules at all, and they're just focused on not binging or not purging, right? And so, being able to assess people and make all these different clinical considerations based on all their different psychiatric diagnoses, to consider the trauma history, the other addiction history, the family history of addiction, looking at potential depressive symptoms, the gut-brain axis, considering anxiety, OCD, body image, internalized weight stigma. You bring it all into a comprehensive picture before you decide what might be some best ways forward for this person. And the person has to be involved in that thinking and decision-making process, right? The days of like, I'm the doctor, I'm the expert, I'm going to tell you what you need to do are over. Like, let's talk about it. Let's discuss the pros and cons. Let's consider these different approaches. And I've also seen, I'll say this, different divergent approaches can work for two different approaches can work for the same person, depending on where the social support is, right? If someone wants to do abstinence and they have a bunch of people that are also abstinent from sugar and they're doing it in a group and everyone's supportive of each other, that could be way more likely to work versus trying to do it alone. Similarly, if they have a bunch of people who are working on intuitive eating and being more inclusive with food and not being so rigid, and they're all supporting each other and not binging and not dieting, that can also work, right? So there's so much to be considered here.
No, I love that there is, it's not that one size fits all, and that the approach is down to each person. So you've talked about the types of foods that you find tend to be the foods that people are more likely to develop an unhealthy relationship with or become addicted to. So what are those foods and why are they more likely to bring about that addiction?
Yeah, it's funny. We talk about, foods with added sugars, salts, and fats, right? And, generally, if it's just one of those ingredients, it's not that salient. It's not that memorable. It's not that rewarding, right? If you were to think about, like, even you put on the table a thing of, white sugar, a stick of butter, and a bowl of white flour, like that wouldn't be that appealing to anyone, right? But if you mix them all together and you bake it for 20 minutes and you have a sugar cookie, that's a whole different story, right?
Yeah, right.
And so, yeah, when you think about the combination of these things that make them more palatable, if you think about, the sugar and the saturated fat and the cold that makes the ice cream, and then you mix it with something that's a little bit crunchy and salty in there, you really get the perfect storm. And then you put the whipped cream on. I mean, like, you can create things that are really designed to elicit the maximum, dopamine response. And there's definitely variations there. I mean, I've spent over 10,000 hours doing nutrition counseling with people. And so I've run across people that are like, I'm not into sweet. They're good. They like savory, starchy, salty, fatty. They're not a sugar, quote unquote, sugar addict, right? But of course, one could argue that they like, refined grains. They like, starches all day long. And so that rapidly turns into sugar. Is there a difference? Why does it matter? And there's so much potential nuance there as well. But yeah, some people are going to be way more into, pizza, cheeseburgers, the combination of, wheat, meat, and cheese, that sort of thing. And other people might be way more into, the sweets and pastries and desserts thing. But very rarely do we find people that are just into like the single ingredient, just the pure candy.
Yeah, okay.
It's like candy's great, but like the candy's got to have some kind of salt or starch or fat in it to make it really exciting to compete with those other products on the market.
I read a book recently, Deep Nutrition by Catherine Shanahan, and in that she calls them techno carbs. So where you've got all those kind of ingredients put together and what that does to the taste buds on the tongue, and then straight to that kind of that dopamine center in the brain. So can you talk about it from a neurotransmitter perspective in terms of what happens in the brain and why we're not happy with just one? So why we go back for more, and we find it really hard to stop?
Yeah, I've been working really hard not to lose people by using advanced terminology like the mesolimbic dopaminergic projection. Those are the kind of things that we say when we write papers to describe things very more accurately. I think, a really simple way of understanding reward is that, the parts of the brain that are responsible for the initiation, production and projection of the dopamine neurons are further back toward the brainstem. We call it the reptilian brain, right? There's, the more evolved parts of the brain that have been added over time, the cortical structures, including the prefrontal cortex, where, there's more rationality, logic, right? And so if you think about the brain as sort of, these different regions that are responsible for different processes, and they're all working to communicate with each other, you've got these more, I like to call them ancient parts of the brain, because you think about like the reptiles before there was like this highly evolved state. It was very basic, like just survival. These are the survival parts of the brain. It understands fight or flight. It understands things that promote survival, like food and like sex, which is why those two sort of addictions are very challenging for people, because they're activating parts of our brain that are designed to promote survival. So when someone eats a lot of highly palatable food, even if there are consequences that the prefrontal cortex is registering as like, that's a terrible idea, you really shouldn't do that, it doesn't add any value to your life, in fact, it moves you away from some of your goals, there's another part of the brain that has actually registered that experience as survival promoting, right? Even if it's not. And the way that I always try to help people remember this is like, if our ancestors 2,000 years ago were foraging and they were starving, and they hadn't eaten for 3 days, and they found the mango tree, right? And then they ended up binging, like we wouldn't have called it binging back then, it would have been called surviving, right? they ate 8 mangoes and like had all this delicious sweet mango effect. The brain, as a way of promoting its survival, would assign a lot of value to that experience, and by doing so, communicate with the memory to store that experience. And so by storing that experience, it will be able to produce the suggestions to recreate that behavior. So let's say a year later, that person was starving in the jungle. They could remember like, oh, that was the way to the mango tree, right? And so, being able to understand the neuroscience of addictions and put it in the context of eating behavior can be super, super helpful for people. So once you've had those binges, you realize that, the more pros and con parts of the brain can make a strong case against it. The more limbic structures, the reptilian brain, are making a case for it. And these two parts of the brain are trying to work it out and figure out like what's the best sort of course of action. Now, to tie trauma back in, most people, that don't have quote unquote addictions should be able to recruit their, willpower or choice mechanisms and, recruit the responsibility to not do the thing. And when people have addictions, whether it be alcohol, food, caffeine, nicotine, behavioral addictions, et cetera, one of the ways that we understand it is that, that prefrontal cortex that makes those sound decisions can oftentimes go offline and be unable to really step in and make that informed decision. And when people have a lot of trauma, particularly early in life in the first 18 years, some of the connectivity between these parts of the brain can become compromised, right? And so that's why there's such a strong link between trauma and addictions. It's that because of the trauma, the corticolimbic communication network is compromised. And so that limbic system, those more reptilian, I call them ancient dopaminergic structures, survival-based mechanisms are dictating behavior more, and you can't recruit those prefrontal cortex processes as well, right? And so that's why recovery, abstinence, mindfulness, a lot of those things, what we were essentially trying to do is help get these different parts of the brain to communicate better with one another, bring the prefrontal cortex back online, have it be capable of stepping in to make those, more sound, logic-based, rational decisions that actually promote survival rather than give the brain the illusion of survival promotion.
That's so interesting. That's a really interesting, because that makes so much sense to me, because I talk to my ladies, particularly on the alcohol side, about when we make that association, when we're really stressed and we drink wine and it stops us feeling stressed, then our brain remembers that. So the next time we feel really stressed, the brain doesn't go, oh, you're going to feel shit tomorrow. It goes, right now, you just need to drink wine because the last time you did that, that made you feel better. So it's really interesting to understand how this is all happening, actually. That's brilliant. And so what would be the ways that we can start to really, really improve the prefrontal cortex in terms of being able to step in a little bit more? So you mentioned meditation and mindfulness, and I've read a lot about that as well in terms of changing the hippocampus part of the brain and everything else. But so what else would you suggest that people could start doing more of?
Yeah, I mean, changing the human brain, right, is like, that's the gold, right? Like, how can we, change the functional connectivity, the structures, that's the major question. And I guess I'd like to say that it's accessible. There's data to support brain changes, but I just like to remind people that those types of changes are slow, right? So like, be patient with yourself, allow the practice to ensue for 1 to 3 years to allow this sort of healing to happen. One of my focuses is on nutrition therapy. And so, I happen to have a bias toward food because that's what I do all day long with people, right? So I'd like to highlight some potential there. I think that, being able to create a very consistent message around food-related circadian rhythms, around macronutrients, carbohydrates, protein, and fat, around micronutrients, around phytonutrients, and around, fibers and everything else that's involved in food, can be a very, very consistent way of teaching the body that there are no threats, there are no crises to be managed, right? And I'm calling this trauma-informed nutrition. So if someone is moving through their day with, I don't know if I'm safe, do I need to manage these crises? I have to just get through today. Therefore, I'm going to be willing to engage in the behavior that I don't want to engage in because my survival today supersedes everything else, right? Like if that's sort of the dynamic that's at play with the brain, you want to think about ways that you could reduce the perception of crises at the body and brain level. And so people that try to diet and they overshoot the mark, cutting out, entire macronutrient categories, or, what I'm really biased against intermittent fasting because I work with binge eating disorder treatment. I'm not saying it can't work with people. I'm just saying people like to skip breakfast and not eat all day and have large meals in the night. Like, if someone's trying to recover from trauma and addictions, that could really set someone up to be in a more sort of sympathetic kind of fight or flight. We don't know if I'm safe. And so using nutrition, carbohydrates, protein, and fat, multiple times a day on regular intervals, balanced eating, right? Those are the kind of things that over long periods of time can help really create the consistent message, right, to your body that there is nutrition, there is safety, we are good. You don't need to upregulate the reward response to certain foods because they're deprived. You don't need to, right? And so, we're lacking really good data showing the effect of long-term nutrition trials on brain health, but we have a lot of associational studies and observational studies to show that people who eat more, plants and phytonutrients, fibers, we can significantly decrease depressive symptoms. There's a lot of promise for nutrition interventions. That I think one of the reasons why we don't have such good data there is because nutrition is slow. It's not like a medication that you could demonstrate its efficacy in 30 days. Like you want to know, like nutrition, like let's do this for 18 months, have a whole revolution in your body. And those kind of studies are difficult to do because then you have to control for too many variables. It becomes too expensive, and self-reported dietary intake. And so, my bias toward nutrition is based on my clinical experience, seeing miracles, but it's sort of a bummer that we don't have the kind of, gold standard randomized controlled trial evidence to support this. But I'm telling you, one day those studies will be done.
Yeah, absolutely. And how do you make the assessment when you meet a client as to whether they have food addiction or a dysfunctional relationship with food? Like, what would you define as being the difference?
Yeah. So part of, working with me prior to even the first session, I have people fill out forms for me online, and I use validated instruments that literally assess food addiction, categorize it into none, mild, moderate, severe. Okay. But then I also assess eating disorders, right? Using validated instruments that look at the presence of dietary restraint, binge eating, other compensatory behaviors. I assess for somatic symptoms across all the different organ systems, inflammatory conditions. I look at adverse childhood experiences. I look at PTSD symptoms. I'm looking at perceived discrimination. I'm looking at how often people eat certain foods. And so I do a very comprehensive intake process that I think, isn't common in my field because, I have training in nutrition as well as mental health. Yeah. Right. So I'm able to bring all these things together, which, it doesn't really exist. A lot of people that are mental health professionals, like you can't really touch the nutrition so much. People that are doing nutrition, right, like aren't comfortable touching mental health. So we're creating a new field to be able to merge these disciplines in some ways that will foster more collaboration rather than competition.
And do you see success in your clients in recovering from whatever their addiction is without needing to go into deep mental health therapy and from using more nutrition therapy? Or do you feel like it has to be both together? You have to kind of go back into the past and dig around a bit and do some healing work? Or because some people don't want to do that, right? They don't want to open that door. So what do you see as being most effective, or does it depend on the person?
Well, it certainly depends on the person. Thank you for that. Some people have, I think it's safe to say that a lot more of quote unquote mental health disorders have biological underpinnings that can be linked back to nutrition. Okay.
Yeah,
and so, that's definitely gaining interest. And, part of the reason why, therapy works so well is because of the therapeutic alliance, right? You build trust with someone, you feel safe, you feel understood. And, a dietitian or, someone at my level is able to provide that for someone without being a quote unquote therapist and without going into the childhood or getting into any specifics about family systems. So I think a lot of people feel some of the benefits that one would get from therapy, from the alliance, from the relationship with the right provider.
Yeah.
And I think it's safe to say that with respect to trauma treatment, there are times when the time is right to go to be with a trauma specialist and go there and visit that and do some of that work. And for a lot of people, they're better off just looking forward and staying in the here and now rather than constantly chasing the past. And, I've come across a lot of people who have sort of been led astray by, qualified mental health professionals who are just trying to pull them in their directions and build new theories up for them. And, so I think to answer your question, one of my visions is to be able to show that, my program, which is, in development, my online program, it's called Wise Mind Nutrition.
Awesome.
Yeah. It's a 30-day nutrition program for mental health. Which is data driven. The website is wisemindnutrition.com. All the curriculum is being recorded right now, really high-end videos that we're making. But yeah, I have a secret goal that I'll be able to do that 30-day program, which is basically nutrition and lifestyle medicine, sleep for mental health symptoms, and put it against something like DBT or some of these more classic mental health interventions and just show, what some of the differences are in the measurable outcomes.
Yeah. Please send me the details as soon as that is ready, because I will share with my community, because that sounds, I already can think of many ladies who would love to do something like that. So can you share with us, before we finish, just some of your success stories? So just share with us a couple of the examples you can give of people who have been, in a truly a place with addiction, whether it be alcohol or drugs, and then maybe that has swapped to food or something, and then they have found their way out of it.
Yeah. I'll try not to, I'll cluster some cases together so that I'm not conveying anything specific. I work with a lot of women that have alcohol use disorder and, bulimia nervosa, and a long history of dieting and body dissatisfaction. And, very oftentimes, it's the primary thing that sort of drives the alcohol. Of course, one could argue that there might be trauma or other more upstream drivers, but it seems like the body stuff and the food body stuff shows up. And then once the alcohol starts in the teenage years, right, that's the food and body stuff sort of get quiet. They go away. Maybe there's some purging behavior or some binging or something here and there. But when someone's in active drinking, the noise around food and body is low. And so I end up oftentimes getting people in my office or on Zoom who have recently gotten sober, and now the food stuff has really started to show up, become noisy again. perhaps they've started purging and over-exercising and really concerned about their outfits and their outcomes related to being sober, and end up working with someone like me who, can really aim to reduce the amount of noise around food and body, take a look at all these old ideas that have been driving the thought processes, do some cognitive restructuring, nutrition therapy. Sometimes we need gut-based interventions with supplements, and talk about the whole dimension of wellness. And really the main work is to really, challenge a lot of these long-held beliefs about, how much I should weigh, how I'm supposed to look. There's very often a discrepancy between what someone's mind wants them to weigh and what their body wants to weigh. And it could be just a few pounds, but if it's a discrepancy, it can create a lot of issues. Some people have really internalized a lot of weight bias. Some people are totally, byproducts of a lot of societal level weight stigma, and just being able to have a place to talk these things through, for me to be a safe place for promotion and recovery. I've helped so many women and men become abstinent from purging, from binging, from dieting, from over exercising, while at the same time being able to improve the quality of their nutrition, quality of life, right? And so it's a beautiful intersection piece where people can get abstinent from eating disorder thoughts and behaviors, and at the same time improve their nutrition, improve their health, and essentially start living in a body that feels more like home.
That's so interesting what you say, because I relate so much to that. As soon as I started drinking, all the negative self-talk about my body kind of stopped, because I was just getting pissed all the time. And then I felt connected because I was out making friends and laughing and doing all of that. So that became the thing. And then I stopped drinking, and then sure enough, they start to come up again. But then we also find in the early days of sobriety, I was eating all the sugar because my body was just like, where's all the sugar gone? I need to eat more sugar. So then you feel shit about yourself because you're purging on the sugar. And so it's so interesting to understand why this is all happening. A lot of my ladies will say to me, oh, I thought I was going to lose loads of weight when I stopped drinking, but I haven't. And I will always ask them to look at what they are eating and have they replaced with sugar. But I'm also thinking, even if they haven't, it takes a while for the body to rebalance, right? It doesn't just happen in a few weeks. For some people, it does. Like some people, they go, oh my God, I've lost 4 kilos straight away. And others sit there going, well, I haven't. Why hasn't it happened to me? So can you just speak a little bit on that?
Yeah, I think the most pervasive assumption that I have to work with people on sorting through is this idea that, body weight is purely just a function of calories in and exercise. And, that model is very much not untrue. But for example, if someone has like long-term exposure to alcohol and they've got some intestinal permeability, they might have a lot of inflammation going on, and that might take a while to resolve, right? For example, if someone's working with a lot of low-grade systemic inflammation or gut dysbiosis, a loss of beneficial bacteria, like those are the kind of things that we would need to address clinically before you can expect your body to make some of those other changes, right? And so, lots of potential contributors to body weight, even looking at things like pollutants and toxins, microplastics, and sleep quality, and age. People think age is like, they want to weigh at 50 what they weighed when they were 25. It's like, yeah, good luck with that. Okay. The data just doesn't support that. I mean, you could try to chase your wedding dress all day long, but listen, okay.
So we have to get to a place of acceptance as well, of being realistic. And
so important. That's such a big part of the work that I do, right? I oftentimes look at the highest adult weight someone has and the lowest adult weight, and I ask people if they have a weight in their mind that they want to be, just to assess how realistic is someone, right? If, like I said, if someone is like chasing a weight that's lower than they've ever weighed in their adult life, right? It just shows how the pursuit of thinness can be relentless and really prevent people from having a really good outcome. Because no matter what happens, you're now eating great, you're moving your body. People are still upset with the outcome because their body dissatisfied,
Yeah.
So generally, yeah, to think about realistic weights, it's usually somewhere in the range between someone's lowest and highest, right?
Yeah. Yeah, because exactly when I think about the ideal weight, it will be the weight that I was when I've done extreme dieting and I've hardly eaten anything. And then I go, that's the weight I need to get to, but I don't want to do extreme dieting. And it's
right. Yeah. Yeah. That'd be like me saying, I want to weigh what I weighed when I did crystal meth every day for a year. Like, it's like, oh, you want to chase that body that it's not realistic or sustainable, like guaranteed disappointment.
Yeah. Exactly. I have loved talking to you. Thank you so much. So where can the ladies find more about you? And I'm so keen to hear about this 30-day program. I will have so many ladies to send your way, David.
Yeah. Yeah. The 30-day program is, the website is alive and well, and there's videos there. We're doing signups for the newsletter so we can keep people up to date. That's Wise Mind Nutrition. I also have an Instagram there that I just started, as well as a YouTube, Wise Mind Nutrition. My clinical practice is at Nutrition in Recovery, which is nutritioninrecovery.com. There's a contact page. My personal Instagram, Twitter, and TikTok is Dr. David Wiss, which is the same across all those. I put out several Instagram videos per week, little 1-minuters. And, I love interacting with people. And so, yeah, following my personal social media, sending me a message through the practice website, and following Wise Mind Nutrition are all excellent ideas. I really appreciate chatting with you today.
Yeah, absolutely. I really appreciate it. And when do you think the 30-day program will be ready?
This summer. Yeah. I mean, the process of it, this isn't just a master class. This isn't like, sign up and get the videos. It's like, we're building an app. We're doing data-driven. We're doing it right. Yeah.
Sounds amazing. I will keep in touch with you. I will share all your website in my group, and just love your work. Thank you so much for your time.
Yeah. Thank you.
Take care. Bye-bye.